Hi, welcome to our special 4-part webinar series in recognition of Menopause Awareness Month. We're proud to bring this important conversation to life through a partnership between Alloy Health, a leader in evidence-based menopause care and telehealth solutions, and Medovia, the U.S. workplace leader in menopause and midlife health. Throughout the series, we'll break down the myths, share the latest science, and highlight the real experiences of women navigating menopause, perimenopause, and beyond. Our goal is simple: to replace silence with knowledge, empower women to advocate for themselves, and give organizations the tools they need to build supportive cultures. Together, Alloy Health and Medovia are working to change the way menopause and, frankly, this stage of life is understood in healthcare, in the workplace, and in society. So thank you for joining us as we open the door to honest, informed, and hopeful conversations. Today, we are addressing Black women and menopause, and Medovia is joined by Dr. Kudzai Dombo. Dr. Dombo is a board-certified obstetrician gynecologist and currently serves as the Director of Advocacy and Outreach and Prescribing Physician at Alloy. She combines deep clinical expertise and experience with a commitment to health equity, focusing especially on the midlife health of Black women. Welcome to the show, Dr. Dombo.
Thank you so much, Kim. It's such a pleasure to be here today.
Yeah, we're happy to have you. What drew
Yeah.
you into this work? We talked a little bit about it before we started pushing record, but why are equity and representation in women's health, especially in midlife, important to you?
Kim, that's a really great question. And I think it started by my own perimenopause journey that started about 2.5 years ago. And as I navigated through some of the symptoms, which weren't typical, but debilitating, I realized that I not only, number one, wasn't aware of what was going on in my body, but then number two, when I encountered the health system, I ended up in the emergency room for an episode of severe dry eye where my vision was compromised. It was just painful, gritty. I was not able to work. So I had to take a week out of work. I couldn't type. Couldn't do anything. And I was diagnosed as having a condition called phytokeratosis, like in an emergency room, which was Welder's disease, is what he said. And, of course, that leaves me in a panic of what does this mean for my career? End up seeing a female ophthalmologist who was in midlife herself. She was in her 50s, and she was able to tell me this is a severe form of dry eye. And this can occur, with chronic contact lens use, but specifically like in midlife when you start to have hormonal changes, that are consistent with, menopause or perimenopause. These are some of the precipitating factors. And so it was such a relief to be able to hear that, number one, but also to be correctly diagnosed. And then also to have to navigate, okay, what is next for me? And I think the journey was fraught with, pre-auths, medications costing $700 a month. Like it was, and I thought to myself, if I'm having such trouble navigating this,
Yeah.
and I'm in the health system. I'm in the health system. What is the standard woman who is, not within the system, who has access to being able to meet with a doctor within a couple of days of an incident like this happening? What is their experience, number one? And then number two, as I continue to take care of women who were perimenopausal and menopausal, and I noticed that, okay, the tides are changing and how we are, the ability to really advocate for them. Like I started to see less and less Black women in the conversation and in the different rooms where we were talking about this and having these conversations. And I would start to wonder, okay, if I'm one of the two, in a room of 100,
Mhm.
where are the other women, and not only that, but is this information getting to them? Because as I did more research, I understood that Black women are impacted differently, you know, during this time. And I felt so, and I don't know if the word is inflamed, but, impassioned
Mhm.
to be able to bring the conversation to women who, in different ways, right, to see how we can engage them in the conversation and help them look at their options, not just for symptoms, but for their long term, right? Their
Yeah.
long term health care. Because as we'll go into, Black women were, higher risk for cardiovascular disease, higher risk for hypertension, diabetes, some of the more chronic diseases. And this information may not be known. And the way to a road to prevention is really treatment before, but also during that menopausal transition to reduce the risk.
Yeah. I'm so glad that you have the fire in your belly, and you're doing something to change the narrative, and actually not change the narrative, but bring it forefront, right? Because
Yeah.
it's a really important conversation. You mentioned that the menopause journey is different for Black women, and I'm wondering if you can
Hmm.
unpack that a little bit for us
Yeah.
and talk us through those unique health disparities that you see
Yeah.
in your work.
Yeah, absolutely. And I'm going to go and really discuss the research, the data, because I think it's important for me to be able to speak from information that has come from studies. The SWAN study, which was started in the 1996, and it spanned about 2.5 decades. And what they did was they looked at women across the nation. So it stood for the study of women across the nation. And this was in all cities across the United States. And what they did was they enrolled 3,302 women. And what they wanted to make sure of is that they had a cohort of Caucasian women, Black women, Hispanic women, Japanese, and Chinese women. Okay, so that they can kind of look at throughout the midlife transition. And these women were aged between 42 and 52. Throughout that midlife transition, what do they find when it comes to their menstrual periods, to their symptoms, to, some of the conditions that they experience when it comes to, discrimination. They wanted to look at how their bodies, what kind of exercise, what all these different aspects of during this midlife transition, what happens. And what they found specifically for Black women is that Black women enter menopause earlier, so approximately 1.2 years earlier than Caucasian women. And they also found that Black women experience their symptoms longer, and specifically the vasomotor symptoms. And they also found that their symptoms were more frequent and they tended to be more severe. So these are statistically documented data points. And I think it's also important to know that there was a breakdown that looked at hormone replacement therapy, or menopause hormone therapy, as we call it nowadays, and the prescribing the prescribing practices of physicians. In 1999, before the Women's Health Imperative, it was about 27% of women were on, hormone therapy. 2020, it was about 4%. And out of those, that 4%, when it came to Black women, it was 0.5%.
I
Wow. Wow, wow.
I've never heard that statistic before,
No.
so that's
Yeah.
shocking.
Stunning.
Yeah. So I think these are some very this is some very real data, and it's not just observational. It's really based on longitudinal studies where they followed women over time. So they do experience a very different, experience. I mean, I could go into more detail where, when they looked at sleep, right? I think it was Caucasian women tended to complain the most about sleep symptoms, but when they actually did the actigraphy, and the actigraphy is the test, when you have a sleep study, they really examine the length of sleep. They found that for Black women, even though they didn't complain about it, their sleep was on average less, that like in terms of the time than it was. They got less hours of the restful sleep than, you know, other women. And so it's just important to notice that there are very specific changes. I could go into even when it comes to depression, you know, there were very specific statistical analyses that were done on a large scale to assess these differences.
I find it interesting. So, Black women experience menopause earlier, longer, and more severe. It
Mhm.
is
Yeah.
what you've said in a nutshell. And you noted the SWAN study, and we're familiar with the SWAN study, but even in the menopause space, we don't really hear the SWAN study referenced that often. And I find that interesting. I'm wondering if you can speak to that a little bit, and
Mhm.
also talk about some of the other root causes that might be driving inequities, whether
Mhm.
it's in research, whether it's in those systemic barriers in healthcare. Or bias. I mean, we could probably have a whole podcast just on that topic
Yeah.
alone.
Yeah.
Can we move into that conversation a little
Yeah.
bit and unpack that?
Yes. So when it comes to the Swan study and why it hasn't been discussed, I think what I've seen is having this conversation enter mainstream has been the focus, right? Because if we're going from shame to like a 2023 article in the New York Times to
Mm,
like, it's just been a building up of really getting the conversation into mainstream so that people are talking about it. And my desire is that with time, these statistics from the Swan study will become more a focus because I think right now we're focused on like, okay, how do we bring this about? No matter who it is, whether it's a celebrity that brings it out, who can bring this conversation so that it can be taken seriously and so that clinicians in general can realize that, you know what, women are actually self advocating for themselves based on this information. So I feel like we've reached a major milestone. I mean, the next milestone is the FDA and this black box warning, right?
right.
So
Right.
we are reaching great milestones. Unfortunately, when it comes to the Swan study, being able to have enough voices that bring it up and talk about it, I think is one thing that my desire is for, as we move forward. I know that the findings around Japanese women and Chinese women, they tended to have less severe, symptoms compared to Caucasian, and for Hispanic women, I think one of the things that they noticed is that the vaginal symptoms are what they complain about, even though they have really bothersome, vasomotor symptoms, but it was more the vaginal symptoms that they complained about. So these are all nuances that I think it's important when it comes to clinician education, right? That this is going to be important when it comes to making sure that we're looking at equity. Because if we're not looking at these inequities, what are we truly, how are we truly making the space equitable for women to see themselves representing? And then the second question you asked was root causes, driving these inequities. I think, again, there's clinician bias. I think one of the things that I know, especially when I was still delivering babies in the hospital, is that, we know the maternal mortality rate is 3 times higher for Black women than it is for, you know, other women. And so knowing that, a lot of the underbelly of that has been part of it has been clinician bias, right? And systemic barriers. But I think we have to address that I think sometimes symptoms can be minimized and reframed as stress. And so it's really important that there is not just, oh, you have to complete your bias training once every 2 years.
Mhm. Right.
But I think as we bring about change in, education for clinicians, that bias is also something that is consistently brought to front so that as clinicians we are aware of what our biases are and
Right.
that women's symptoms will not be minimized or reframed as stress, especially if you're a Black woman and that you can just handle it. So
Mhm.
that's one. And then I think, systemic barriers like insurance inequities, occur. And then access, to menopause specialists, people who are trained, in being able to. So what I hear a lot, especially in our support groups, is that, I have patients, Black women, who go out, ask their doctors send in synthetic hormones. And then because they've done their research, hey, I don't want synthetic hormones, I want bioidentical hormones. And then it's like, okay, here you go. And then the next thing they're like, I'm bleeding. What do I do? We don't know. So being able to have access to specialists, women who, or doctors who, or clinicians who can actually help women, is very, very important. And
Mhm.
that is another systemic barrier that I have noticed. And then I think research, right? It hasn't involved a lot of Black women to date. So even with the Swan study, for every single location, right, they had a white cohort and then they had either, again, the Hispanic, the
Yeah.
Chinese, the Japanese. So every location they had a white cohort, but they had to have a cohort that represented a different ethnicity. So I think, I mean, and I'm just grateful for what the Swan study has showed us and the information. But I also think that we need to do better when it comes to research in general, because even in the WHI, the number of women, even though it was a large study, did not have a significant portion of Black women involved in that. So I think that there's no data reflecting Black women's experience
Yeah.
besides.
That's interesting to me. There's layers, right? There's not enough
Mm,
research for women in general, period. Let's note that. And then you add that additional layer on top of, right? So now we don't have representation for Black women with the little research that we have for women in general. So it is an obstacle. And I think often about the insurance, the way that our healthcare is structured today and the inequities that it seems like we're not doing better. We're going the other direction right now.
yeah,
And I can see where that would be extremely challenging. Hopefully that is changing.
yeah,
I know that there are, Alloy does a fantastic job in caring for women in menopause, but certainly not having access to certified menopause specialists, is another barrier.
right,
You're being dismissed by your GP or, fill in the blank, whoever it is that you're
yeah,
seeing, that
yeah,
they don't know. I'll give them that maybe, right? We don't know because we know that they're not. We have a very limited number of physicians that are trained in menopause
yeah,
adequately. So another layer, right? Yeah.
right.
It's complicated.
Yeah. And I think there's one last thing, April, the mistrust in the medical system that I
Mm,
see within, in general, like Black women, not all Black women, but I think there is this underlying fundamental, like, mistrust, and it's rooted in historical, things that have happened, historical harm. So overcoming that as well is a huge of what is contributing to these inequities is really this mistrust, and how do we, you know outside of a community,
yeah.
how do we really address this so that women can understand that, okay, we'll walk you through your process, to
Right.
getting what you are comfortable with as you go along with it, because I really do believe, in hormone therapy for those who are candidates, in terms of reducing the risk for chronic disease, and even when we talk about longevity, estrogen is a very, in general, more harmless than it is harmful. And it obviously involves a very personalized approach so that patients can understand, okay, address that there is a little bit of mistrust, but let's educate you as well, as what the pros and cons of all the options are.
Do you think
Yeah,
Black women are suffering more
that was my
because of
next
that?
question.
It really, I have to ask that question because I'm truly curious. I don't know. I'm
Mhm.
a woman. Do you think that because there is that mistrust with the healthcare system, that Black women are suffering more?
I do, and or they're willing. I shouldn't say that, but there's a level of, okay, I'd rather just go this route versus this. I can navigate, suffering through, because there is that level of, I'm not sure. I don't want to add anything into my body. And when you break it down for them and share with them that, especially with bioidentical hormone therapy, all I'm doing is replacing a little bit of what your ovaries aren't naturally producing anymore. That's all it is.
Yeah.
And it's almost like, like it's like a, wow, I've never heard of it like that. If that's all it is, because explaining to them that this is bioidentical, this is similar in structure to what your ovary naturally produces, it really makes a difference for them to be willing even to take the first step, versus it having this connotation that, oh, they're treating me with hormones and there are side effects and all these different things that could happen to me. I feel like it really requires just breaking it down simply.
Yeah.
And
Yeah.
I can also imagine that if, you're hanging around with your group of friends and nobody's doing anything about this and is not informed,
Mhm.
then why would you go out on a limb to do something that somebody that you don't even know or looks like you is doing,
Mhm.
and, we don't talk
Yeah.
about it and it's fine and I'll get through it. Because when I look around at my peer group, we're all like talking about that this is an important thing, probably because this is what I
Yeah.
do all
This is what we
day long.
do, right?
But I know that if I didn't see people like me or no one was talking about it and everyone was just suffering to get through it, because we've done that so many times with so many other things, that it would be a hard sort of mind to change.
100%. And I have a story for you because I had a very specific patient who found me on Instagram. I brought her into Alloy because I was like, look, we can't communicate on Instagram
Yeah.
about health issues. And so she came into, Alloy, and we went through absolutely everything. She had a group of friends, and they were Buddhist, and she was Black, but she had her Buddhist group of friends, and they all had told her she had prescribed to what they prescribed through, and they had basically were like anti-hormones. And so it wasn't until she started to be like, okay, I'm starting to feel miserable, and I'm starting to see Oprah's talking about it. All these different people are talking about it. And so now I'm going to do my research. So she took time to do her research. While she was doing her research, she had her doctor start her on Veoza, which is a non-hormonal therapy. But then by the time she came to me, she DM'd me, brought her into Alloy. We did a full consult where we went through all her options, and she was ready. She was ready. And she said, I'm actually going to choose this for me because even though my friend group isn't there, I want to be able to plan for not only what I'm dealing with now, but also for my long-term health. And it was a victory.
For her. That's
Yeah.
good.
Yeah.
Okay, switching gears a little bit. I read a New York Times article recently that Black women have been experiencing more unemployment in the past 2 years, that the
Yeah.
federal workforce hit Black women particularly hard. How does menopause intersect with race and workplace inequities as it comes to menopause? Because I'm surprised by that. And I know that, the women that are probably being laid off in the federal workforce have worked there forever and
Yeah.
are probably of menopause age. And so again, the workplace is being, in discrimination, intentionally discriminating with women in the workplace. Can you talk about the sort of race and workplace inequities as it's related to menopause for Black women?
Yeah. And so I think, just as you said, I think in general, Black women are already navigating these, either whether it's pay gaps, racial bias, they face an extra burden when it just comes to the workforce in general. But when you think about going through menopause, and I've seen this with my patients, their symptoms, they affect their concentration, their energy, their confidence. And when that starts to happen, you really need a level of workplace support, right? In whatever way that looks like. So I have patients who have told me that they either are business owners, they can't get off the couch because of these symptoms, that just energy is depleted. You know, they're running their own businesses and it's just like, I just don't have the energy to do it. I have other patients who, are responsible for $1 billion contracts, right? And they are unable to, like, they're in meetings and their confidence is affected because their memory is, they have issues with their memory, concentration, and they are really lacking confidence when it comes to, my gosh, what is it that I, need to do now? Because I really think that my boss is not going to fire me, but they're just thinking my work performance is poor and I'm going to be in trouble with, at my work evaluation. So I think when it comes to Black women in general and what we're seeing with these federal layoffs, so I can't control what's happening with the federal government because they're choosing to do or we can't control what's happening right now. But I do think that when you look at the workspace for Black women, they're even going to be more impacted because, if they're not getting the cure for some of the symptoms that they're experiencing that are affecting their performance, without that workplace support, you're going to have missed promotions. When it comes time for promoting somebody, if they're having issues with concentration, they're not going to really be on the top, tier for a promotion, reduced pay, and some of them cut back from their careers, and that's the sad part because, one of my greatest joys is being able to see some of these women, go from where they were, start hormones, and they're just like, "Oh my gosh, I'm actually participating."
Changer.
And I feel, yeah, and I feel like
Feel better.
I feel better. And, all that lack of confidence that comes with, your symptoms, it goes away. And, I see patients, I'm like, you're a different person. So I think looking at, you know, Black women, again, 0.5% on hormone therapy, to be able to, like, and a lot of Black women have more physically demanding,
Mhm,
job positions. So this already sets them back
mhm,
to some degree, because 0.5% is a very low percentage of Black women who are on hormone therapy. And as we know, this can be something that's really helpful in just restoring the estradiol levels and getting you back to um, a better performance, whether it's mental clarity, and all the different things that can contribute to,
yeah.
reduced performance.
So the access to healthcare is important. I'm hearing that over and over and over again here in this conversation so that they can get the support that they need. I'm wondering as we think about employers and the workplace, because that's the space that we sit, right? I'm wondering what role employers can play in
Yeah,
reducing those healthcare disparities.
yeah,
Moving beyond, I don't want to say just healthcare benefits because it's extremely important to have those benefits to get the help that they need so that they can get back to the workforce and perform at that peak, right? With the confidence,
yeah,
feeling better. It's really
yeah.
important. But what else can employers do to play a role there in reducing
Huh.
those healthcare disparities?
Yeah, and that is such a great question because I think, yeah, okay, awareness is one thing, but I think changing policies is really where, that speaks volumes. Okay. And so when I think about, flexible scheduling, there may be women who have really debilitating problems with their sleep and maybe just starting a little later, and ending a little like having that flexibility for scheduling, I think is one core aspect. If you have to wear a uniform at work, having breathable, material so that it's not something that's going to, be worse off for you if you are having and experiencing the hot flashes and sweats. Having material that's breathable, that's one way to look at it. I think, I look at temperature controls, like do patients like do employees have the ability to regulate temperature within their spaces. And then I think, even looking at paid time off for doctor visits,
Mhm.
does that employer offer time for patients to actually, get the care that they need? Because I think sometimes you're looking at, oh, I don't want to take the time off because I won't get paid for it. But then
Yeah.
is there that time paid off available? And then I think, insurance covering, menopause care so that women can go over all their options and know what their options are. And then I think it's important to know that, okay, if one course of treatment isn't working, let's move on to another so that, women don't feel like they're stuck in okay, I used my one benefit or one whatever that I get. Like, but that is something that's available, consistently so that I think what I found is that validation and options are something that women like, even just getting that, it's like a huge weight off their shoulders and they feel like more empowered in this journey. So it's not just okay, you had your appointment, here's your treatment, goodbye. They need that. And then training managers, because I think sometimes managers, okay, you can, but what are you training them to be looking for?
Right.
In some of the women, because I think what tends to happen is if a manager isn't aware of what some of the lived experience is of, the employees, it's really hard for the manager to be able to identify and ask more questions,
Yeah.
when they see something, within a patient like concentration. They're not like the assumption can always be, not working hard enough, not,
Mhm.
and so I think it would be nice to be able to train or like it would be imperative. I shouldn't say nice, imperative, for managers to be trained to be able to identify things.
Those are great. Those are all the answers that we usually talk about on why supporting women in the menopause space is important. I want to go
Yeah.
back to something you just said a few minutes ago about start trying something and then you got to sometimes you got to tweak it. You got to experiment and you got to get curious about what's working for you. And I don't know I mean, my experience is that women are not good at that. I take the prescription and I just deal. And I
Mm,
would imagine that you probably have to talk to your patients. And I don't know if this is a Black woman issue or not, but really figuring out what works for you might take a minute.
hmm
And
Yeah.
it takes some time to figure it out, and you might have to experiment a little bit to feel really good. Feeling good is just so important, especially at the stage of life where we're sandwiched between taking care of our children and our parents and, our careers and all those kinds of things. To feel crappy in the middle of that is
Yeah.
not helpful at all. Can you speak to
Yeah.
that a little bit?
Yeah. No, I completely like understand what you're saying about feeling good. And what I find with patients is it's so interesting because this is what I have to tell them. They come and they're like so confused about, okay, do I do this? But then if I lock myself into this, then, or should I choose this? And, and then if I lock myself into this, like they see it as one fixed solution. Meanwhile, this is like trial and error. And I tell patients this all the time. Your body and your girlfriend's body are completely different bodies, okay? So your genetics, your body chemistry is going to be different. So what worked for her may not work for you. And I think changing the mindset that it may take a little bit to get you to the sweet spot. So we may start you with progesterone only if you're in early perimenopause after 3 months, because that's usually how long it takes to adjust to any form of like a new hormone within your system, right? We all have estrogen receptors in different parts, and how those estrogen receptors respond, it can take a minute, because again, we have them all over our bodies. We may notice some side effects. And again, it takes your body, what, a good few weeks if you have side effects for them to go away. So I think it's really important to understand that, okay, we start within 3 months, we're looking at making tweaks if necessary. And then boom, we go another 3 to 6 months. We need to make tweaks. We do that if necessary. So it's not a one size fits all. It's very personalized. And your symptoms, the ones that are the most burdensome, are different from somebody else's. So we will only know what works for your body based on what you tell us. And we try to tailor it to, again, not only your symptoms, but your age, your family history, your medical history, right? And your allergies. So there are a lot of factors that come into play in determining where we start. And then also how we make adjustments after 3 months. I've had women who it takes a year for them to get to a point where, they know that things work. So that's where I always tell patients that it's important to be patient with your body and that this is a journey. It's not a one and done. It's a journey where we require frequent check-ins to see what modifications need to be done.
I think that's huge for all women to understand.
We're all different.
Yeah.
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 My symptoms are
Mhm.
different than Kim's, than yours, and right. And we all have comfort levels and how we want to manage those symptoms. And to your point, our backgrounds and our genetics, and it's all different. So
Yeah.
I love that you bring that up because we sing that song every time we gather with a group of women. We were just saying that last night in the fireside chat. And we were also, it's interesting, you said something earlier too that I want to come back to. It's interesting that you mentioned community groups because at the end of the fireside chat last night, really the conversation turned to, "Isn't this great that we have each other?
Mhm.
Can we can share ideas? We can share what's working for one. Maybe have you tried this?" And I think that's important because you don't know what you don't know, right? Oh, I
Yep.
didn't realize that that was available, so I'll ask my healthcare provider about that. The community groups and support, building that tribe is really important.
Mhm.
And I know that there's research that shows that it will actually lessen our symptoms just by
Yeah.
thinking about it and being
Yeah.
there's you co-lead support
Mhm.
groups, right? Wellness support
Yeah.
groups. And I'm
Yeah.
wondering what you're hearing directly from the women in your support groups. And I'm also wondering how that can help fill gaps with the traditional healthcare systems.
Yeah. It's I mean, they're powerful. They're so powerful. We get, Black women from different parts of the country. And the one thing that I know is that I hear women share about, I thought it was just me.
Right.
I thought it was just me. And then I also see, how to learn self advocacy, right? So one woman who may be further along in her journey, and then somebody else who's just starting in her journey, they are actually be like, wow, I never thought to ask my doctor that. And so, we have women come back just as I shared earlier, wow, next time I come back, you're going to hear that I'm on hormones, for somebody who was not a believer in them. I had another patient who was on hormone therapy and she had a history of fibroids, had started some irregular bleeding and they couldn't get it under control. So they told her, okay, let's do a hysterectomy because she was 55. And you know what she did? She said, you know what? I want to know what my other options are, and she came to the group and she asked, hey, I was looking them up and a uterine artery embolization I looked at and I thought about that. Lo and behold, there was somebody else who had a uterine artery embolization in the group. She could share her experience and just things to consider. And it was such a moment of like integrative support and her feeling good about being able to go back to her doctor and share why she wanted this, more empowered. And so I think, learning that self advocacy is something that I see in the groups. And then I think it's like, just of course, group validation, shared solutions. Women come back and say, okay, well, this worked for me, or I tried this, sugar that's non glycemic, or, it's more expensive, but this is what really helped me get, my blood sugar control improved when I chose to adjust my nutrition. And so there's this sense of sisterhood. It's like, I'm looking out for you, you're looking out for me. I want to help you understand what worked for me with my skin symptoms. Like, I use this brand, I use that brand, and it helped me. Again, I'm just sharing knowledge that I've gained. And I think that, really fills the gaps that the traditional healthcare system leaves open. And they feel like, okay, yes, I may not have had a long conversation with my clinician, but I came to this hour support group and I felt like, wow, this answered my question because I could tell her what a uterine artery embolization exactly was, explain it, how it's done, what some of the side effects may be, and I'm not sharing this with them as their doctor, but just as a source, of, medical information that they may not necessarily get within that short visit with their doctor.
And then they have that information and they can then take that to their healthcare
Mm-hmm.
provider, right? Yeah.
Yep.
Yeah. So
Yep.
it works both ways. I love that. Before we move on, I want to can you please tell us how our listeners can be a part of those community groups?
Yeah. So Alloy at www.alloy.com, we actually have I'm going to send this to you. We have Eventbrites and we actually send them out and as long as you're on the email list, we can actually send you one. You can register. And then as long as you're on the email list, you'll get them, every time they go out. And that way you'll know when they are at least a week before. And we do them twice a month. So that allows women who aren't able to attend every month, but we have women who come every single time. We have like a crew of women who are
it's the tribe,
who are like,
These are my people now. And yep.
Yeah. It feels good to be a part of a community that you're familiar with. We all want it. We all want that, right?
Yeah.
We want to feel
And
connected.
I also have younger perimenopausal women, like in their early 40s, who actually come and they say, I am so glad I am getting to hear this, see this, learn this, so that when my symptoms get worse, it's just good to see women who look like me, who I can actually be like, wow, I know what to expect.
Dr. Dumbo, we could talk for another couple hours. Really appreciate your knowledge, experience. What did you call it? Fire in your belly. I just love that. But if you could leave our listeners with one key takeaway,
Mhm.
what would you want to leave them?
I would say don't normalize suffering. I did that, and I ended up with debilitating symptoms where I actually started to cut down on my shifts at work because I was doing 24-hour shifts, but don't normalize suffering, because I think it's very easy to say, oh my gosh, I'm getting older because I'm 50, turning 52. And I was like, okay, this is maybe just what happens as I get older, and I normalized it to the point where I I was, in emergency room, but I just didn't know what was going on. So that is one thing that I would say, do not normalize suffering. And then I would also say, if your clinician is not being proactive, in addressing your symptoms and discussing all of your options, because I think it's really important for there to be agency. You leave feeling with a sense of agency. There are always other options, and you can always give your clinician, opportunity by maybe taking an article with the 2022 guidelines, for menopause, hormone therapy, if you really are considering hormones. But I also say that if you're reaching a wall, your story is not over. Like, there's always somebody else, or there is somebody else who would be able to help you.
That's
Mhm.
great. So
We
where
always
can
say
people
you can divorce your
divorce your
clinician
doctor?
if you need to,
Mhm.
yes, and go find
Yeah.
another one. It's okay.
Mhm.
Yeah.
Yep, you have
Yes.
my
Okay.
permission.
Absolutely.
So where can people find you?
I'm at Alloy Women's Health, or it's www.alloy.com, excuse me, myalloy.com. So they can find me at Alloy, and that's where I spend majority of my time.
And you're on
Yeah.
Instagram. You noted
Yes, I'm on. Oh, that's
Instagram.
right. And
Yep.
on Instagram at Dr.Kudzai, where
Fantastic.
I
We'll
try
put
to
that
share
all in.
pearls.
Okay. Yeah, I'm gonna go follow you as well.
Yeah.
Um,
Okay, wonderful.
before we sign off, we ask everyone what the best piece of advice you've ever received has been. What would you say to that?
Follow your gut. Follow your internal, like that internal voice about what you may experience or feel, and know that one door that may appear to be closed, there's another door open somewhere else.
Mhm. Uh-huh.
Wow.
So I do that for patients, for other clinicians, for myself. I think it's really like we have wisdom within us and we know.
We do. Just have
We
to
do,
listen.
and when we go
Yeah.
against our gut, oftentimes it doesn't work out. So we need to listen to our gut. Yeah.
Yes.
Thank you for that. And thank you so
Yeah.
much for spending this time with us and sharing your expertise. I'm sure we'll have you back because there was a lot that we didn't have an opportunity to discuss. But until we meet
Yeah.
again, go find joy in the journey.
Yes,
So
absolutely. Thank you so much.
take good care.
All right. Bye bye.